Here is a short overview on the history of San Lazaro Hospital. The churches in the Philippines with its rich history could claim as one of the prominent figures of altruistic works in the world. All kinds of institution of charity like orphanages, schools, hospital, and the likes were provided by the Spanish friars, some of which is still being utilized today. Between 1577 and 1578, the Franciscan mission started in various locations in the Philippines. One of the notable person that joined the mission is Juan Clemente, a lay brother and a botanist and ordained as a priest throughout his missionary works. Fray Juan Clemente showed compassion to the beggars who constantly gathered to the doorways of the convent. He extended his help by formulating medications and ointments to apply to their wounds. His munificent effort spread and the number of the sick came to seek help to the small chapel. Owing to overwhelming number of people needing assistance, the chapel could no longer accommodate the patients. Fray Clemente sought aid and support from the clergy and was able to raise enough funds to build a dispensary beside the convent of San Francisco within the walled city of Intramuros. The dispensary became the Hospital de los Indios Naturales, also known as Hospital de Naturales. Fray Clemente with other friars catered not just the medical needs, but the spiritual needs of their patients. Early modes of remedies like herbal reliefs, therapeutic oils, and medical supplies could be accessed in the facility. The hospital even supplied some of the medical needs of other hospitals and infirmaries. In 1583, a fire in Intramuros seared significant establishments and institutions including the Hospital de Naturales. With the sustenance of Father Domingo Salazar, the first Archbishop of the Philippines, the hospital was rebuilt as a stone structure. The hospital operations continued until a Franciscan priest Juan Fernando de Leon became one of its patients. Fray de Leon was moved by the works of Fray Clemente in the hospital, and after his recovery from his disease, he utilized his own wealth to construct additional wards and areas. Fray de Leon also instituted the Hermandad de la Misericordia, Brotherhood of Santa Misericordia, to support the facility. San Lazaro Church and Hospital was rebuilt on a land owned by a wealthy Chinese who, before dying as a leper, willed that all rentals collected from his properties be used exclusively for the care of lepers in the Philippines. The hospital received assistance under the direction of King Philip II. Through the patronage of the king, the hospital was subsidized by the government. Most of the prime necessities of the patients like food and medicine were supplied by the clergy and the administration. Wages were also provided for the staff of the hospital. In 1598, at the age of 74, Fray Juan Clemente passed away. In view of his remarkable contribution and compassion for the poor and needy, his funeral was attended by numerous people and respected individuals. In 1603, Hospital de Naturales was again seared by a fire in Intramuros. Prior to the reconstruction of the hospital, a new place where the hospital should be relocated was agreed. The district of Dalao, currently Paco, Manila, was chosen to be new home of the Hospital de San Lazaro, one of the oldest hospitals in the Philippines. The Hospital de San Lazaro accommodated 150 lepers from Japan to the Philippines by the Emperor Iemitsu in 1632. The malevolent act by the Japanese due to expansion of the church to their empire was, however, unsuccessful. The clergies brightly accepted and catered the patients with the disease who are often mocked and unwanted by the community. Due to lack of finances, facilities, and supplies in the hospital, Governor Don Manuel de Leon donated 12,000 pesos consequent to his death for the building of new establishment. The construction of the new facilities of the hospital took place between Dalao and Balate under the management of Father Fernando de la Concepcion in 1678 to 1681. In 1762, the British took over the administration of the hospital during their invasion in the country. It was used as a vantage ground of offense to the Spaniards. In 1783, the hospital was again demolished by reason of the impending reinforced attack of the British. The Hacienda Mahalig in Rizal Avenue area was the definitive and current site of San Lazaro Hospital. By the royal decree of King Charles III, the construction of the hospital and the church was completed. In 1785, the hospital occupied the 400 hectares of the Hacienda Mahalig, with new establishments and structures. The hacienda was also used as a mean of revenue, tenants paying rents for the utilization of the land of the state. In 1859, the hospital was about to shut down primarily because of the constant flooding and plague crises to the community. During this time, a Franciscan administrator Felix Huerta was appointed to administer the hospital. Through his effective administration, the hospital was prevented from closing down. The Americans assumed the administration in 1898. This was the time San Lazaro Hospital became a contagious disease hospital under the Board of Health known as the Department of Health today. In 1904, the hospital catered mentally ill patients. Some of the mentally ill patients from Hospicio de San Jose were transferred to the hospital. Dr. Elias Domingo, considered as the first Filipino psychiatrist, worked for San Lazaro Hospital after he was sent to Pennsylvania to train in psychiatry. In 1918, after the First World War, Dr. Florentino Ampel, the first Filipino administrator of the hospital, was appointed. From 1930 to 1931, insane patients were transferred to National Mental Hospital, National Center for Mental Health today. In 1949, patients with leprosy were relocated to Tala Leprosarium, now Jose N. Rodriguez Memorial Hospital. American military base camps were largely established in Subic and Clark. Many sex workers would be inflicted with sexually transmitted diseases during these times. San Lazaro Hospital became one of the referral center on HIV and AIDS. The hospital was used as the surveillance site for the Naval Medical Research Unit, NAMRU-2, an American biomedical research laboratory of U.S. Navy for infectious diseases. Since 1986, most of the cases of HIV/AIDS were admitted to the hospital. Today, San Lazaro Hospital is mandated to be the National Referral Center for Infectious and Communicable Diseases and the Referral Center for HIV and Hepatitis confirmatory testing. It continuously provides healthcare services to patients afflicted with emerging and re-emerging diseases. The hospital also provides healthcare programs focused on disease prevention, education, training, research, and public health services. Th.